this is absolutely essential healthcare to provide to our patients.
UVA Health launched a new outpatient clinic called the UVA Perinatal Mental Health Clinic that specializes in psychiatric care for moms during pregnancy to 1 year after giving birth. Today, WUVA spoke with psychiatrist Dr. Jennifer L. Payne, OBGYN Dr. Chantel Scott, and nurse practitioner Ginny Bowers about opening the clinic and the care it offers.
From a clinical perspective, it really makes sense to have a perinatal mood disorder clinic because a lot of people are really not sure how to best manage psychiatric illness during pregnancy and in the postpartum time period.
There's a lot of stigma still associated with mental health. It does not get acknowledged.
I have found over time that it is increasingly difficult to get help for our patients. Obstetricians have limited training in management of mental health conditions. I've found that waits to get in to see a psychiatrist or a therapist have been incredibly long, and particularly in the postpartum period, sometimes it can be very acute and patients can need help quickly. Counseling and therapy is limited in our area, but in many areas throughout the country, particularly for people without means who can't afford to pay out of pocket. So we were able to start thinking about how we could get help for our patients in a timely fashion, in a comprehensive way.
And that goes in conjunction with my research. So we were able to look at data from over 1 million pregnancies and look at factors that were associated with self-reported postpartum depression symptoms. We found that women over the age of 40, and particularly women over the age of 40 who had twin pregnancies, had a significantly higher rate of self-reported postpartum depression symptoms. Depression and anxiety disorders are the most common, but we can see other types of psychiatric disorders. So for instance, obsessive compulsive disorder, or OCD, can be really common in the postpartum time period. And we can see post-traumatic stress disorder, including from the trauma of going through a traumatic delivery.
In severe cases, we might find somebody that hasn't slept for days, has not eaten for days, showered, maybe even starting to hear things and see things that might not truly be there. So really, if you just feel that you are heading down the path where you're becoming overwhelmed, that's the time that I want you to reach out.
They can get in touch with us in a variety of ways. Probably the easiest way right now, if they're not a UVA obstetrics patient, would just be directly call the office here at Northridge Psychiatry. If they are a UVA obstetrics patient, to talk to their obstetrician, and any of us can arrange an appointment for them to be seen here.
We are hoping to bring more staff on, so we would like to have a therapist that is dedicated to the perinatal clinic. We'd also like to get a case manager that is partnered with OB-GYN. There's a medication called brexanolone that we've gotten approval for formulary, but we have not worked out the details on how to deliver it to women with postpartum depression, but we will.
Currently available on Tuesday mornings and Wednesday afternoons, the clinic provides moms and their families with greater access to key mental health care. I'm Ayathi Gogineni, WUVA.